Hi, my name is Maritza Velasco, and I chose the Arabic culture. So, starting with the region, the Arabic community originates from the Middle East and North Africa that makes up around 22 countries. The majority now that have moved to the United States now live in California and in Texas. That makes up around 4 million. So, health beliefs and practices. Illness is believed to be a life imbalance and God's will. The culture believes in praying, and they believe that eating healthy is just as equally important for good health. Both men and women are allowed to express their feelings. It's not something that should be hidden. Herbal remedies are used when illness occurs. It's usually the first line of defense that they go to instead of going to a hospital or to a clinic. The father is usually the one that makes the decisions for the family, and women are protected and usually prefer the same gender of healthcare providers, such as the doctors, the nurses. In health and disease, they have an increased risk of diabetes, cancer, heart disease, and lactose intolerance. They're at a higher risk of contracting hepatitis C, and obesity runs more likely in the wealthier family. They are least likely to get asthma. There are higher rates of tobacco use, and some parts of the Arab world will still practice the female genital cutting. It's not so likely anymore, but for some, mainly the traditional Arabs that still live in the Middle East will still practice that. So the nursing considerations would be to be aware that the culture may not seek Western healthcare until the illness has progressed. Um, and allow praying and other practices as long as it does not cause any life-threatening events. Ask if they have or currently are taking any herbal remedies and document that if any. Avoid using medical jargon, usually because the first language is not English. Ask in what ways you can help teach them, again, because of that language barrier, and allow them to express their concerns and make sure to speak to the person in charge about any changes. And also be aware that they may be hesitant to share health information that may bring embarrassment. You would also want to assess the risk of diabetes, heart disease, and cancer, explain the importance of getting checked early and taking preventative measures, provide education regarding smoking, and provide smoking cessation program referrals. Assess whether the female has had FGC done and refrain from being judgmental, especially because it could be a traumatic experience for the female. So when it comes to religion, most of them practice Muslim, Christianity, and Judaism. They pray about 5 times a day. And the holy month, which is Ramadan, there's no eating between sunrise and sunset. So usually before the sun rises, whether that be like at 5 in the morning, they'll get up, eat, and then they won't be able to eat again until sunset. The Jewish Sabbath and holy day may require clients to postpone non-life-threatening surgeries, and visiting the sick is an important practice. Nursing considerations are allow a quiet time for praying and uninterrupted time, allow religious articles in the patient's room, prepare to have a lot of visitors for the sick patient, collaborate with a dietitian to support Ramadan. Fasting patients will need accommodations. Like I said, they may need to be fed way earlier than everyone else. And be aware that some surgeries may be postponed. So verbal and nonverbal communication. Arabic is the main language slogan. Interpersonal distance is close within the same gender. Leaning away is considered rude. Even standing far away is considered rude. And touching is only okay within the same gender. Greeting is done by a slight bow and hand over the heart. Handshake is usually the common way of greeting someone, and eye contact is avoided with the opposite gender. The nursing considerations would be assess language and the need for an interpreter, usually in cities like Paris and Silver Springs. There will probably not be someone who can speak Arabic, so they will most likely need an interpreter. Be aware of your own style of communication, whether that be verbal or nonverbal. Avoid hand gestures such as pointing someone or using the OK symbol. The OK symbol is perceived to be a threat or to cast the evil eye, and avoid leaning or standing too far from the person you are speaking with. Engage actively in conversation. When you're speaking to someone from the culture, make sure that you are giving them your full attention, otherwise it's considered rude. And shake hands when meeting with the client or the client's family. So nutrition and diet, no pork or alcohol products. Usually that is only done within like the Muslim religion or Judaism, not so much really Christianity. They usually eat lamb or goat meat in small portions. Dairy is rarely consumed because most of the Arabs are lactose intolerant. Warm fluids are preferred over cold fluids, and meals are eaten 3 times a day. Nursing considerations would be assess food preferences, note any restrictions, collaborate with a dietitian for special diet needs, and to incorporate the use of the culture's food. Assess calcium levels due to the dairy intolerance and provide food at the patient's desired time. So end of life care. Arabs might be opposed to speaking about death if possible. If the patient is close to death, they would like to bring the patient home and have them die at home instead of the hospital. Emotions are openly expressed. The funeral and burial should take place as soon as possible out of the respect of the member who has passed. The deceased member should be handled with care and covered after they had passed, and usually in the Muslim religion, they are washed by the same gender, and they are perfumed and covered in white linen. So black and white clothing are acceptable colors for mourning. Nursing considerations would be assess and document the family's preference regarding death. Assess and document if the family would like to donate organs. Autopsies are forbidden, but organ donation is viewed positively. Be aware that you may have a lot of visitors. Postmortem care may be done by the family. Position the bed facing towards Mecca if possible. Here are my references. And that concludes my presentation.